Hello everyone, and thank you for returning back to my channel, to the returning subscribers, and also if you're new to this channel, I post videos every week, videos educative, educate you on your health and help you to live a healthier life. So welcome. In this video I want to talk about a very common disease condition, like I've been doing. This is known as diabetes mellitus. Diabetes mellitus is very common. You are related to someone that has it, or you yourself might be suffering from it, or as you go out every day, it's as common as you go out every day, you definitely meet someone that is diabetic. So what is this diabetes mellitus? Well, it's a medical condition that is characterized by increased sugar levels in your blood. Well, as you eat food, when we eat food, carbohydrates, carbs, when this food gets into our stomach, digestion starts actually in the mouth. So when it gets to the stomach and this food is broken down into digestible parts, all the parts involved in digestion of food are very important. For example, the pancreas. The pancreas is an organ that produces agents like insulin, for example, that is very, very important in the digestion of sugar, or moving of sugar that's in your blood to your body cells for storage. Is insulin. Insulin is produced from the pancreas. It is very important. That's what I meant to say. So insulin is responsible for moving sugar that is gotten from your food you've eaten from your blood to your body cells. This will maintain a normal glucose level in your blood. Okay, the normal value will be up here on your screen. The normal value of glucose in your blood changes as you depending on the time of the day. If you just woke up and in the morning and you're hungry, if you've just eaten, or you've just eaten within the last 2 hours, it varies as the day go along. But there is a standard range, a reference range. This is what I'll post on the screen for you. The body tries to maintain your glucose level. Glucose, sugar level are used interchangeably. It means the same thing. Your body tries to maintain this glucose level within this range, to be within this range. So if it gets higher than a certain range, depending on the kind of investigation or the kind of test you do, and it's repeatedly at that high range, you might be diagnosed with diabetes mellitus. So why is it important, or why is it a problem? It's because a high level of sugar in the blood is dangerous to your body. It can destroy your eye. It can cause lead to other infections to invade. We talked about candidiasis the other day. Diabetes is one of the causes of candidiasis as well. It can be a predisposing factor rather to candidiasis. It can lead to diabetic foot, diabetic ulcer. It can lead to all other metabolic diseases. Diabetes can also lead to hypertension, but we'll talk about all that some other time. So diabetes is not a good condition. It can lead to, it's a gateway to other things, many other disease conditions. So that is why it is very important. So okay, let's talk about the types of diabetes. Diabetes can be generally divided into 3 types. The first one is called the type 1. The type 1 diabetes mellitus is found in the younger age group. This young age group includes children to young adults. So this type usually results from lack of insulin, a lack of insulin. In these cases, it's usually an autoimmune disease that has destroyed the beta cells of the pancreas that is responsible for producing insulin. So when this happens, there's a total lack of insulin or too little an amount of insulin to participate in the breakdown of and in the metabolism of glucose. So this will result to type 1 diabetes. So type 1 diabetes mellitus, it was formerly known as insulin dependent diabetes mellitus as a former name. So let's go to the next type. It's the type 2. The next type is the type 2. Type 2 diabetes mellitus is the type that occurs in the older age group from 40 and above, 40 years and above. This type is commoner in people who are obese, people with who are overweight. It also has genetic predispositions as well. So if you're related to someone who is diabetic, this might be the type we're talking about. You find patients with this type of diabetes to be on the bigger weight size as opposed to type 1 diabetes where you rather losing weight. So type 2 diabetes was formerly known as non-insulin dependent diabetes. Type 1, remember, was called insulin dependent diabetes because you needed insulin injections, insulin shots for the treatment. But this type 2 was referred to as non-insulin dependent diabetes because but that's usually that has been phased out. You can also treat type 2 with insulin dependent with insulin shots. Let's go ahead and talk about the third type. The third type is referred to as gestational diabetes. Gestational diabetes is the one you usually found in women, in pregnant women who were previously not diabetic. So it usually happens to women who become pregnant, usually in the 3rd trimester. These women were not previously diabetic. So that is why it is referred to as gestational diabetes. It doesn't happen to all pregnant women. It doesn't happen to all pregnant women, just for some. And that is why the pregnant women, when they come for antenatal clinic visits, they are usually tested. Their urine samples are taken and urinalysis performed, checking for glucose, or checking for proteins and some other things. Glucose is majorly because of this diabetes, screen for diabetes mellitus. So these women might go on after delivery, the condition will usually resolve. In some, they might develop diabetes later on in life. So these are the 3 that are very common. These are the 3 types of diabetes that are very common. In the second part of this video, we'll talk about causes, we'll talk about management and what you should do. So if you have questions before the release of the next video, please write comments down in the comment section. Write your question, ask your questions, or send them to my email if they are private. Send them to my email on my social media. You can reach me on. The links are all in the description. Please like this video, subscribe, and share to your friends, to your parents, to your relatives, so that they can see and learn. Thank you very much.